I can almost say it's an effleurage without the movement. So instead of moving, I'm using exactly the same grip and taking the tissue to what the tissue allows and holding. The others are modifications of my normal massage techniques, which might be a circular technique, it might be a direct technique, but they are all directed towards repairing and restoring tissue glide in the scarred area specifically, but often in the surrounding area wherever I find a tissue restriction. The axillary area responds a little better to a shearing kind of pull, either by asking my lady to put her hand up as far as she can and adding a little bit of a stretch into her own system. Not hurting herself, taking the tissue and just adding. And one of the benefits of allowing my patients to do self-massage, most of my mastectomy ladies don't allow themselves to be touched there. And they avoid the area themselves automatically. So I force them to get back in there by giving them a hands-on specific exercise. For myself, I would be a little more specific in guiding the tissue where I find the restriction. When I get to this restriction, that is a non-pathological restriction. So on that, I go into the tissue, either using a deep massage technique across the fiber of the tight area, if I can identify the long head of triceps or teres major or the infraspinatus system as tight. That is where I would then go almost on a more aggressive deep tissue mobilization kind of feel. Also taking the shearing into account as the superficial layer first, and then probably on the deeper layer I may well end up with a good old-fashioned trigger spot or two in there as well, which also need attention along the normal lines. And I often find I can be here early on, day 2, day 3, day 5 post-surgery, but leave this alone. But as long as that is tight, that is going to be restricted forever. So this is part of the restriction, but functionally, that one changes your shoulder mechanics, which leads to complication in shoulder systems 3 to 5 years down the line.
And do you find that with that massive amount of scarring and removal, actual removal of tissue, which would change the way the person is able to move, that you get effects throughout the body from this kind of surgery that you also have to deal with as a physical therapist?
Yes. Most definitely, what I find, especially in the slightly more neglected ones that come to me late, are major postural changes. Because you've got to remember, from being an upright person, and quite often I've had models coming into my practice and telling me afterwards, I used to be a model, but now I can't even get my head up. And now that's one of the problems I have with postural re-education. For instance, if I have a scarred fascial system, I cannot start postural re-education in the presence of a scarred system. So my approach there is to get the soft tissue mobile first, and the person straightens up by themselves. And then I come in with my postural re-education routine.
Once they're able to actually comply with what you're asking them to do.
Absolutely. Because what's the point of telling a woman to sit up straight and walk up straight if the body is like a tight spring that's just going to pull them straight back into that negative posture? And that brings us to the emotional. Because the emotional is never talked about, because we're scientists, remember? We're doctors, we're physiotherapists. So let's leave the emotions at home. But can you imagine having been a positive person and probably chairman of your board as a woman, 35 years old, that suddenly was this positive, great, successful businesswoman who's now being pulled into a negative posture to hide behind the others. She's got no control over that emotionally because she's from there to there. And it's not because of her turning into a negative person. It's the scarring that's pulled her there. And that is what I sometimes, find the most challenging in my practice.
Because they're not hearing from anyone other than you that their posture, this posture has something to do with the way they're feeling. They're often perhaps blamed for becoming depressed or negative.
Yes. Get your life together, woman. You have breast cancer. We've cured your breast cancer. Don't be so negative. Stand up straight. I can't because I'm stuck. Please help me. I can't help this. And that is the big challenge I think we are facing. Not the breast cancer, not the surgery, not the therapeutic intervention necessarily, but giving my traumatized lady some dignity back by being proud of standing or sitting up straight. And it's got nothing to do with projecting your breasts out into the world. It's got to do with me as a positive person, as a specific poise. And if I'm scarred, I can't reach my full positive poise. And I start to act the way I feel or look.
And that, as much as anything, could be the long-term effect of breast cancer and the surgery.
I think so. The long-term effect is people stop complaining. I've heard and seen this in the literature. I'm tired of telling the doctor about my pain, so I'm just going to shut up. Sorry, keep quiet. I'm not going to mention it because I'm this fortunate person who's made it through an ordeal. And I'm positive because I'm alive. So I'm not going to complain. I'm not going to talk about it. And I start just withdrawing myself. I start withdrawing myself from my leisure activities, partially because of the pain and the tightness in my shoulder. I have to work, so I'm not going to withdraw from my work activities, but I'm going to start slowly cutting down on my social responsibilities over time.
All right, thank you. I think good. Are there any questions that you would like to add to that?
That's great.
That was fantastic. Thank you very much.